Hello, thank you for joining us today for the Wellness Solutions edition of our Spectrum webinar series. We have a great panel of guests today, so we're going to talk through all the rules and regulations around wellness. We're also going to hear from an employer group about how wellness works for them. So let me just introduce our speakers to you real fast. First up, we have Trenton Lutz from the Jamestown Board of Public Utilities. He's been with the BPU Health and Wellness team since 2014, and in 2017, he became the team leader, where he now oversees 12 employee volunteers that represent the entire municipality's divisions. And the Board of Public Utilities, as you would imagine, is really a wide-ranging organization that has a lot of different positions, some behind a desk, some out in the field. So, that's why they need that really strong volunteer corps to go out there and build up their wellness program. It is such a successful wellness program that it has been named one of the healthiest companies in America by Interactive Health, and the BPU Health and Wellness Program has repeatedly been awarded the Western New York Healthiest Employer Award in the medium-sized category by Buffalo Business First and by Springbuck. They've also been honored as one of the healthiest 100 employers in the nation by Springbuck. Trenton is also the founder of the Work Well Chautauqua Network, a group of like-minded companies, organizations, nonprofits, and county departments who are focusing on improving the health of their employees, the community, and the county. We also have Kelly Dempsey, the Vice President of Phia Group Consulting. She specializes in plan, document drafting, and review and compliance matters. She's previously worked for a TPA and an insurance carrier, so she has a lot of experience with all of the fun things that TPAs get to face on a daily basis, like reference-based pricing, COBs for Medicare, provider disputes, balanced billing, usual and reasonable fees, all that fun stuff that we all love working with so much. Kelly is admitted to the bar of the state of Ohio and the United States District Court in the Northern District of Ohio. She has a JD from Cleveland Marshall College and is board member of Project Learn from Medina County, serving as president of the board in 2020. And then finally, we are joined by Adam Russo, the co-founder and chief executive officer of the Phia Group. He is also founder and managing partner of the law offices of Russo and Minshoff, which is a full-service law firm devoted to representing employers, plan fiduciaries, third-party administrators, and carriers in employee benefit matters across the United States. In 2019, he served as chairman of the board for the Self-Insurance Institute of America, also known as SIA, and he currently serves on the board of the Massachusetts Association of Health Underwriters. And I am Teresa Vincent. I am your host for today, and I'm also Nova's product manager. In addition to being product manager, I'm a member of our very own in-house wellness team, our renovations committee. I'm also a trained mindfulness facilitator, and one of my wellness offerings is teaching mindfulness and meditation to my coworkers every other week. So those are your presenters for today. Nova is coming up on our 40th birthday. We are TPA, but we feel like we're so much more than that. We take the everyday experiences you expect from a TPA, we really elevate it to the next level. So you can get your medical, your dental, your COBRA, your reimbursement account administration. You can do private label partnerships, but our real goal is to dive into the data, understand the data, and come up with personalized options in collaboration with our clients to deliver the best health plan solutions. And you're going to hear a little bit more about that as we walk through this presentation. The Phia Group has a huge amount of expertise in all sorts of areas around healthcare compliance and regulations, and the Jamestown Board of Public Utilities, as I mentioned, is actually a public utility. So it's all the workers that deliver water, sewer, all those very important services that we look to in our public infrastructure. So let's talk about the spectrum of health plan performance management opportunities. You'll see we've got this prism here, and this is the way that we really like to frame out all the different solutions and options that we talk about. So this webinar is actually part of a series of 7. If you notice, there are also 7 colors in the rainbow. So you'll see how that lines up. Today we're going to focus on yellow. But where it really comes from is when you look at a prism, you have that white light source that comes into the prism, and then it refracts out to all these different colors. So you get all these wavelengths and gradients. And you'll see here we have our 7 broken out: network, telehealth, wellness, medical management, pharmacy management, our benefit design tiers, and reimbursement. So the TPA is really that prism that refracts all of the different colors and goes through all the different solutions. So today we're going to focus on wellness and the different gradients within that yellow wavelength of light. So wellness is a big buzzword in the industry. That's something that a lot of people seem to really want. It's actually at this point become not an optional benefit. It's become more of a table stakes sort of thing, where everyone wants to see what are you doing to help improve your client's health all the way around the board. So someone comes to us, they want to be our client, they want to build a wellness program. What does that actually mean? How does it look? Well, when you look at it on the spectrum, if you're going from the more established programs all the way up to the more emerging sort of innovative programs, we begin with organizational wellness. So that's something like I mentioned at the beginning, where you have an internal wellness committee, something that Trenton is on that he's been a part of, that he's really blown out, you'll see, to far end of the spectrum. You know, it could be a discount program for services that you can access in your card. And then the next level is really looking at some outcome-based wellness with rewards. This is where Kelly and Adam are going to talk through. There are a lot of different rules and regulations around this, how you can attain your goals, access health improvement resources, maybe bring in a third-party vendor, and reward your employees for doing things that improve their wellness in a way that follows all the different laws. And you're gonna see there's a lot of it. It's kind of an alphabet soup. And then going further on, you can actually dig even deeper and do biometric screening. You can do health coaching. You can connect to apps that really support maybe different disease states like diabetes, or behavioral health is one that we're seeing come through. There's a lot of talk about financial wellness. There are all these things that go into comprehensive well-being that you'll see, you know, as you get more saturated in the color of the spectrum, as you dive more deeply into all the different wellness offerings that are out there. So before we go into the rules and regulations and the employee story, the client story, just to give you an understanding of the TPA role in wellness, our job is really sitting in the middle and helping find the balance. So if you want to do clinical programs, we may have tools that can support that. If you want to do non-clinical programs, we may have access to different health libraries or resources that can help you do that. On the clinical side, our programs are connected back to our case management and disease management departments. So we can actually offer support in a more deep way than you would find in other areas where they don't have that backbone of the case management services that connect into wellness programs. So we can provide that support. We can look at things that help with financial well-being, both for the company as a whole, so you're looking at company wellness, but also looking at that individual financial well-being piece, your overall well-being, you know, things like your emotional well-being as well as your physical health. And it's important to do these in the workplace, because the workplace is where you spend most of your time during the day. It's a very easy access point for people to obtain services that they maybe would feel otherwise they don't have time for or wouldn't make a priority. So when it's embedded in your workplace, in your wellness program, provided that you're following all the rules and regulations that we're going to talk about in just a second, you know, that really is a great opportunity to really get the greatest amount of health, wellness, productivity, and positivity out of your employees. Really working in partnership to make sure that you have healthy, happy people working for a healthy, happy company. And with that, we're going to transfer over to the wellness regulations and coming through all the confusion, or what we call the ladies of wellness, GINA, HIPAA, ERISA, all of them. So I'm going to turn it over to Kelly and Adam to walk us through these regulations.
All right, thank you. So today we have a quick overview of Wellness Program Compliance 101, and I will warn you right now that there's a lot of content on these slides, and I could make this presentation much longer than 15 minutes, but the key takeaways that I would like people to leave with are really what I have on my last two slides. It's the status of where we're at with the rules right now and how to maintain compliance with those considerations right now, because like Teresa said, things are kind of obviously in flux and have been for quite some time. So this is a quick checklist on this slide of the things that we're going to go over, you know, at a very probably high level because we only have so much time. So let's dive right in and go to the next slide. And you know, when employers want to talk about wellness programs, they start with the concept of, do they want a participatory wellness program or do they want an outcome-based program? That's kind of the first threshold. So the first one we have here is participatory, and this is truly just people participating in a program without any specific expectation regarding their results. So it can be something very simple, like the employer offers a smoking cessation program and a reward is given regardless of whether or not the person actually quits smoking. So very basic concepts when it comes to participatory wellness programs. For those employers that want a little bit more of a challenge and want to make something a little bit more robust, we can go to the next slide and talk about health contingent wellness programs. So in this case, the individual is required to satisfy a specific health factor to obtain a reward. And there's actually two types of health contingent wellness programs, which is where things start to get a little complicated. So there's activity only, which is an individual is required to complete an activity in order to get a reward. So it can be something like walking every day, something very basic, but it does require some sort of physical activity. The next piece is outcome-based. This is the other action, which requires an individual to obtain a certain outcome. So for example, you take a biometric screening and you get your cholesterol levels and your BMI and all those fun numbers that nobody likes to look at. And the goal is to get them into a normal range. And then the reward is obtained by getting them into the normal range.
One thing I want to add there, Kelly, if you don't mind,
Sure,
go back that slide for a second. In regards to the biometric screening, there's been a huge amount of interest in regards to this. One of the things that people look at, obviously, is the cost factor of how much this would cost, and then also how would this be delivered to non-employees. Dependence of the actual plan itself is another big issue that typically comes up. So back to you, Kelly. Sorry about that.
No, it's okay. So when it comes to health contingent wellness programs specifically, which is activity and outcome based, there are 5 actual requirements. So this is where it comes to get a little bit easier because there's 5 things you have to make sure you absolutely have. So one is the frequency of the opportunity to qualify. You have to give individuals an opportunity to qualify for the full reward at least once per year. Pretty basic. The next piece is the size of the reward, and we're going to kind of put a pin in that one for now because the size of the reward really depends on, as Teresa said again, the ladies of wellness. What HIPAA, ADA, and GINA require may differ depending on the different types of wellness programs. So wellness programs are kind of that circular issue where you have to decide what your program is, figure out what rules actually apply, and then go back and make sure you're in compliance with each of those rules. So it's a little circular, but we'll get back to that size of the reward piece because that's huge when it comes to where we're at right now with the rules. The next is the reasonable design. So the reasonable design is obviously just what a wellness program is. The goal is to promote health and prevent disease. So again, pretty basic. Number 4 is uniform availability and reasonable alternative standards. So this is kind of 2 things. Uniform availability just means that the same reward is available to the similarly situated individuals. It's a lovely little tongue twister. So everybody has the same opportunity to get the same reward in basic terms. And then the requirement to offer a reasonable alternative standard. So the reasonable alternative standard, and we'll get to that on the next slide, but before we get to that, we'll talk about the requirement to provide a notice of a reasonable alternative standard. That is a requirement piece. Adam, you want to say something?
A couple of things I want to bring up before Kelly gets into all the compliance pieces, because I think everyone focuses on that, right? What's allowed, what's not allowed from a regulatory standpoint. What people don't look at is what's contractually allowed. And what do I mean by that? We have many clients of ours that have these great innovative ideas. They want to do all these things, yet they never actually check if their network contract allows them to do so. Let me give you an example. We here at Phia, and I'm going to boast about our health plan here for a second, if you don't mind. All of our employees and their family members get free healthcare. Free. There's no premium. There's no deductible. And the way we've been able to do that is over a period of time, putting together the right type of wellness program, the right incentives in place. But this is not something you can just do in 1 year. It took us 5, actually 6 years to get our costs down to a point where it actually made sense for us from a recruitment and retention standpoint, where it's actually cheaper for us to offer free healthcare than it is to try to onboard and hire and train someone. So we've gotten that to a place. But a lot of the things that we do, we cannot do by using Blue Cross Blue Shield network. So instead, what we can't put into the actual plan document, we put into our employee handbook, which is separate. So don't forget, your plan, your actual plan, and the actual company, the employer and the plan, are 2 separate entities. So the SPD is governed by the plan, has the plan in mind, whereas the employee handbook is the employer. So we might mention in the SPD that we have incentives, but we don't go too far without crossing the line of, let's say, our network contract does not allow steerage to certain providers. But so we don't talk about that in our SPD, but we bring that up in our employee handbooks. In addition, a lot of the things that we do, one of the key things that I think is very important to all of your listeners and viewers today is mandatory health insurance workshops. We make it mandatory, no different than you have training for HIPAA, training for security, training to get into a client system, training for software. We look at our health plan no different than any other expense at a company. So if you have training for safety, we do training for health insurance. So instead of just looking at it from a standpoint of, all right, it's an enrollment period, sign up, we talk about all of the cost containment programs, all of the incentive programs that we have, our diapers and wipes program, our direct primary care, our DPC programs, our pharmacy, and also our quality of care programs, all the things where employees can make money in their own pocket, save money for themselves, but also save money for the plan. And what we realize over the years is that that behavior becomes contagious. The minute somebody benefits and profits and sees more money come in their pocket or less money coming out, they talk about that at the water cooler. And that spreads. And because of that, we have changed our patients. The patients of Phia's healthcare plan, we have now turned them into consumers of healthcare rather than just patients of healthcare. So they're not looking at the copay only or what the deductible is. They have a reason to look at the entire bill, the entire plan, the entire offering. But it's important to know you have to look at what your contracts allow you to do. What does your TPA contract allow you to do? Outside of just the regulatory compliance stuff, all that boring stuff that Kelly likes to talk about. Sorry, Kelly, go ahead.
Oh, that's okay. So the last piece that I'll mention on this slide is really just that reasonable alternative standard applies a little bit differently to activity only versus outcome based, and it's actually a little counterintuitive. The concept of whether or not you can require an individual to give you a sign off from their doctor, you're allowed to do that for activity only, but not for outcome based, which again, in my mind, at least, it's a little counterintuitive. But just as an important kind of side note. So we'll go to this next slide about the reasonable alternative standard. So again, you have to provide notice of this action and things when it comes to the reasonable alternative standard. So I'll give a couple, examples. But when it's required is when it's unreasonably difficult for somebody to do this. If they have a medical condition that prevents them from participating, or so they wouldn't be able to complete that. So for example, if somebody is in need of a hip replacement, requiring them to walk 10,000 steps a day, probably not the best idea for them. So there's a couple examples of a activity or reasonable alternative standard for an activity only. So I just mentioned that goal of 10,000 steps a day. Maybe it's only reasonable for them to get 2,000 steps a day. You have to figure out kind of what that makes sense for that individual person. For an outcome-based reasonable alternative standard, maybe the goal is to quit smoking and the alternative standard is just to participate in a tobacco cessation program because it's not reasonable for them to quit smoking for whatever reason. So there's definitely options. And when it comes to the reasonable alternative standards, an employer doesn't have to pick those up front. You don't have to have a set defined, this is what the alternative is. You can create a standard or you can choose them on a case-by-case basis when you talk to that individual. This is where it kind of gets a little bit more case-by-case, figuring out what is appropriate and what is not. And it's always a reasonable alternative standard to just waive, whatever the requirement is and provide the reward. So just, an opportunity and thoughts in the back of your head, obviously it's going to apply differently depending on your individuals. So when we talk about, health contingent programs, we've kind of talked about these, but again, you can always take these other opportunities into consideration. So educational programs, like Adam mentioned, different sessions that the employer has, or if they send them to an external educational program. There's just a couple considerations listed here about when you're required, if you want the person to participate, what you can require them to do. So you can't make the person pay $700 to attend an educational program, and the time commitment has to be, reasonable. So you can't make them go an hour every single day, because that's not going to be reasonable. Work-life balance, all that fun stuff. So let's go to the next slide and to talk about those ladies of wellness. These are all the laws that come into play. And again, like I said, what is permissible and what gets triggered depends on how your program is set up. I'm not going to bore anyone with going in this line by line, but just know that all the different interactions of these 5 different federal laws dictate the compliance structure of a wellness program. And one of the things that I will add in here, just because I can't help myself and because we've been talking about it for so long, is the employer mandate. If you're an employer that's subject to the employer mandate and you want to avoid your penalties, you always have to assume that an individual is going to fail to meet the requirements to get a reward. So the reward can't be calculated into the affordability calculation unless it's tobacco cessation program. Go ahead, Adam.
One thing I want to bring up about ERISA, she's an ex-girlfriend of mine, actually. It's funny because I was born the same year that ERISA was enacted, so I was meant to be an ERISA attorney. I tell people that all the time. 1974, by the way. Every self-funded plan that I talk to, I mean, the number of times I hear this, I'd be mega rich. they say, well, we're an ERISA plan. We don't have to follow any of the laws. No, that is not true. Just because you're a self-funded ERISA plan doesn't mean that you haven't signed other contracts that may apply. Network contracts, state law applies. Your administrative service agreements, your vendor contracts, anything like that, it would not tie to ERISA. So don't assume ERISA is the end all and be all of your plan.
Yeah, that's a great point, Adam. And just to kind of expand on that, pay attention to the wording in these, because those small words, the small differences are the important. So ERISA does prohibit discrimination by the group health plan based on health status. But if you go to ADA, the Americans with Disabilities Act, it's on the employer. So to avoid discrimination on health status. So you've got employer requirements and plan requirements, and they all kind of interact with each other because this is an employer-sponsored program. So the nuances, unfortunately, the devil is in the details. So please don't throw things at me for being a lawyer, but that's where it is. So we'll go to the next slide and we'll talk a little bit about incentives and how the rules again here are constantly shifting. So whether or not you trigger certain participatory and wellness program requirements and the thresholds for the dollar limits that you're required and the cap on the incentive, and an incentive cap applies whether or not it's a carrot or a stick. So just keep that in mind. You can set them up either way. Carrots generally work better than sticks. Penalizing people doesn't generally go over well. But you can trigger ADA and GINA by doing certain things. So if you request somebody to do a smoking cessation program and you actually have them do a swab to prove that they are not on, nicotine anymore, you're going to trigger these laws. So you need to consider that these thresholds when they come into play. And again, you'll notice the last piece on here and that the words that are italicized are always the most important. But the big issue right now is what is voluntary and when do these programs become voluntary and when are they more, for lack of a better term, coercive. Let's go to the next slide. So the next one talks about the interaction of HIPAA and the ACA, and then again, ADA and GINA with health contingent programs. So again, these incentives and the caps of what you can incentivize individuals at change based on what laws you're triggering. And that's, again, I know this kind of makes my head explode, so I wouldn't, blame anybody else for being confused. Go ahead, Adam.
One of the hardest things that we've ever had to deal with is the definition of voluntary. Because the better the actual program, it's actually going to benefit those people that do it much more and quote unquote potentially penalize, right, that stick versus carrot approach, those that don't. So the wider the gap that you have between those who participate versus those that don't, it can be viewed as punishing those that don't. And that's the key. You want it to be successful, but if it's too good and those people get too much of a benefit, those that don't do it for whatever reason, that's when they bring up those arguments that it's quote unquote not voluntary, at least for them. Kelly?
And that's a great segue into the next slide. So we'll talk about where we're at right now and the rules that have changed. Sorry, I heard a little echo there for a second. So there was this lawsuit with the AARP versus the EEOC, and it started way back in July of 2016. So this is kind of a quick timeline of what is happening. And like I said, my last two slides are the most important, and this is the second to last slide. So, this lawsuit happened back in 2016 where the EEOC issued new rules limiting the incentives. And then the AARP sued the EEOC later that year, saying that 30% threshold is coercive. It's still too high to be voluntary because that 30% can be a lot of money to some people. Don't ask me to do math, please. So what happened essentially throughout the court process was that the district court in Columbia found that the EEOC didn't correctly and clearly define what is voluntary and what that means and what that reward can be. So the court kicked it back to the EEOC and said, rewrite your rules. So originally, the rules were supposed to come out in 2019. They didn't. A big surprise to everybody. I think, unfortunately, the last 2 years have kind of threw everybody for a couple different curveballs. So it wasn't on the forefront of everybody's mind. So what happened is that in January of 2021, we actually got new rules. And, of course, with any new set of rules, they weren't exactly perfect. They didn't really clearly, again, define what is, voluntary and what is not. And the incentive examples that they gave were so disparate. It was water bottles and t-shirts versus plane tickets and gym memberships. So something that costs $15 to $20 versus something that costs a couple $100. So that wasn't great examples. So unfortunately, the wellness rules have kind of fallen subject to what happens when there is a large change in administrations on Capitol Hill. If anybody didn't realize, it was an election year. So on top of the pandemic, we had the election. And subsequently, those rules that were issued in January were withdrawn in February. And now we're back in a spot where we don't really have rules again. So let's go to the next slide to talk about what we can do to make sure
basically,
that people
Kelly's saying, Kelly, you're basically telling everyone, just do whatever you want. We have no rule.
I won't go that far, but there are definitely options. So here are a couple different options of what you can do to make sure you're operating within that space and keeping your program voluntary. Some of them are a little more extreme than others. Everything has to be assessed on a case-by-case basis because it's what works for your employees. That's kind of the most important thing. So the first option is just to remove biometric screenings and health risk assessments. That remove those completely, and you will remove any issue, hopefully with the incentives, because that's where the focus was. Next option is to keep the screenings, but remove the incentive associated with those specifically. Or the third option, keep them, but make sure that incentive is only that 20% incentive, which the 20% comes from a study that indicated that 20% was apparently less likely to be viewed as coercive than 30. I think it all depends on what the numbers actually roll out, but that's something that we could probably debate for hours. So the other piece of this is the smoking cessation. You can obviously offer a smoking cessation program that does not have a blood or nicotine test, and then you would not have to worry about that threshold of being coercive. So there's definitely options. I know that people hate when lawyers say this, but everything is a case-by-case basis. You want to make sure what's working for your employees and assessing what rules apply on a case-by-case basis. Go ahead, Adam.
And the reason why you're going to see even more of a gray area here without any real rules being cemented in place is because now all the discussion about incentives is tied to vaccination policies with employers. Can you incentivize? How much of an incentive? Can you ask? Can you require? Can you make? All that is at the forefront of everyone's mind. So all of these little things that are obviously very important, but you can see how they get superseded by other things as we have seen over the past year.
Most definitely. All right, well, with that, the last slide that we have is our plug for our webinar. If you are not aware, we offer webinars on a monthly basis that are also free. So feel free to sign up and attend if you're interested. And with that, I will turn over to Teresa. Sorry, Adam.
I said they're always fun. We call it edutainment. But I'm looking forward to Trenton, see what he's doing with his plan. I'm hearing great things about it, Trenton. So I'm excited to hear about it.
I will say Phia does have some of the best webinars out there. My background before I came over to product management was in compliance, and we definitely relied on a lot of that good Phia content. So that's my backup plug for you guys. Okay, so now that we have the understanding of all the rules and regulations around wellness, all these guardrails that have been put in place, confusing though they may be, we're going to talk to Trenton about what it actually looks like in the real workplace. So once everything goes through this kind of blender of all these rules, what does it actually look like on the ground? So Trenton is going to walk us through the timeline for the Jamestown BPU for all their workplace wellness solution evolution. And you'll see that it really ties in with the spectrum that we talked about at the beginning, where it starts off as a very homegrown program and then actually develops all these legs that really give it a lot more benefit to the employees. So I'm going to turn it over to Trenton, and we look forward to hearing this walkthrough.
All right, thanks, Teresa. So yeah, like Teresa said, I'm here to talk about our program and how we've evolved over the years. Real quick though, let's just talk quick about why we did what we did. Obviously, a lot of those reasons are going to be similar to probably what everyone out there has for either wanting to start a program or the reason that they use to start a program. And that's, we want our employees to be as healthy as they possibly can. There's obviously a big tie-in to that with health insurance costs and other things. But if the employee is healthy and happy, they perform better, they miss less work, and there's just so many benefits to including a program like this that we began exploring it early on. So let's go into the 2012-2013. Now, this was kind of a really soft program launch. We didn't actually have a full committee. We only had a small couple of people who were handling programs kind of like just individual little things that we would do, like weight loss challenges or maintain don't gain challenges. These programs were all funded basically through the employees. The employees were asked to pay a small fee to participate in the program, and at the end of the program, the folks who won, lost the most weight or did the best at maintaining their weight were awarded prizes utilizing the funds that were paid into the program. As we got closer to 2013, we started introducing wellness fairs. We did one of those in August. We had a lot of vendors from the local area come out. We invited employees, spouses, dependents, children. We even had a huge bounce house on site to keep the kids occupied and interested in the whole program. This was kind of all just to sort of learn, what kind of buy-in we had from our employees. Like how were they going to respond to different programs? Also lunch and learn events. We started offering small lunch and learn events and things like that. Now, as we go on, once we go to the 2014, you can see we actually started forming a more cohesive team in this year. What was nice is after we did all the kind of initial stuff in the early stages, we hired, I think it was towards the end of 2013, brought on a new HR director. And he's told me several times that one of the first tasks he was given by our general manager was to begin a wellness program, begin a wellness incentive program, get a wellness team started, and get the ball rolling with this. So we were kind of lucky in the fact that we already had buy-in from our upper management. I know you hear a lot about getting the buy-in and things like that and trying to explain to them, why it's a benefit to have a program like this. We didn't have any of that issue. We immediately had our general manager just say, let's do this. We want our employees to be healthy, which was absolutely tremendous. So this program, we ran this in-house. I think I joined towards the end of this program, thankfully, because one of the challenges we had was a fruit and veggie challenge. And what that was is, keep in mind, we ran this whole thing on basically paper. Employees were given a folder with, a tracking sheet so they could write down whatever they were doing and things like that. Well, one of the programs we offered was the fruit and veggie challenge. And we had this genius idea that we would award a point for every fruit or vegetable that an employee or, purchased at the grocery store. Okay, so it sounded like a great idea, terrible idea. Like we had so many receipts that we were just like, finally we were just like, oh my goodness. And, thank goodness we had a small handful of people who were going through these receipts. And luckily we had requested in advance that in order for it to qualify, the employee had to highlight the vegetable and the fruit on the receipt. Otherwise we would have just spent weeks going through this. So it was a little crazy. And it taught us a lot of different things, and we learned that one of the things we wanted was to have something that was not on paper. So with Nova's help, and going into 2015, we started to bring on a wellness vendor. They helped us ensure compliance. They helped us with an online portal. We got better reporting capabilities and engagement. So employees could just log in, do all of these things. It was a great change. You can see on the bottom of each of these years here that it shows our participation. Way back in the very beginning, there were about 53 people. And I'm going to be honest, I think that 53 might involve a few overlaps because I think it's a grand total of people who participated in certain challenges. But then 2014, we had 84 folks participate. And by going online, we immediately jumped up to 101 people. We feel like it just made it easier to access. The folks were able to get immediate access to it. Now, keep in mind too that our program is open to both employees and spouses. And that was across the board. It didn't matter if you were on our health insurance, which we are self-insured. It didn't matter if you were on our health insurance or not. The employee and the spouse could both participate in the program. And we did offer incentive payouts on that. So along with the to 2015, we also had like team challenges that came out. Those were another great thing that that happened through the wellness vendor. But by paying attention to the trends and listening to our employees, we learned that over time, those team challenges weren't really doing what we wanted them to do anymore. People weren't participating. We actually had employees come to us and say, hey, so-and-so on my team isn't really participating anymore, and they're bringing down the whole team, and we're not reaching our goals. They're like, we don't want to throw them off the team because that wouldn't be, good for the overall BPU. But is there any way we can shift? So by listening to our employees, by listening to what we, paying attention to what was going on, trends and things, we just switched to regular challenges. Everybody participated on their own. You reach a goal, that's kudos for you. If you don't reach that goal, it's also on you. Anyways, so in 2016, we started to realize that, to help reduce our healthcare costs, some of our largest utilizers of our healthcare were actually our retirees and their spouses. In reality, it was actually their spouses. So as long as retirees and spouses were still on the BPU's insurance, we considered them to be eligible to participate in the wellness program. We did this by, instead of giving them a payout incentive like we were doing with our employees and spouses, we instead took that same amount of funds that we would have awarded them in cash at the end of the year and applied it to their following year's health insurance premium. It was a really good idea, and initially we were kind of disappointed because we didn't get a lot of participation from our retirees. But as we thought about it, talked about it with in our team, we realized that those folks who were already retired hadn't been participating in this program from the beginning. They probably had been retired for a few years, and so they weren't really used to this. It hadn't become part of their culture, part of our BPU culture, our employees' culture. And as a result, they weren't interested. They just didn't see the benefit of it. Now, I'm going to jump ahead to now just for a second, but as of right now, we actually have pretty much every employee who retires at this point and is still eligible, who still is on our health insurance when at the time of retirement, is immediately moving into the retiree participation. They continue on with the program, and they all get benefit of access to the portal, screenings, challenges, all of these things. One of the things that we had happen in an earlier Lunch and Learn in 2015 is we invited a group from the UPMC Hammett to come out and speak about heart disease. And this is going to lead right to the carotid artery screenings, because this was actually one of their main focuses during the Lunch and Learn. And what happened was immediately after that Lunch and Learn that we offered, we had, I can't even tell you, it had to have been at least 24 employees come up to us and say, can we get this here? I think this is a great benefit. How do we get this? What do we do? Is it something that we can offer? So we immediately started researching. We started talking with the folks from Hammett, and we came up with a way that the BPU covered the cost to have them come in, do on-site carotid artery screenings for everyone. Anyone who wanted to have the screening done just came on-site, got the screening done. We offered it over a series of, I think, 3 days. And we even had the screeners switch from a few of our different locations, because we are located in several places across the city of Jamestown. So to make it easier for our employees, we offered it in a few different locations. So that's going there. And so moving on to the 2017 then. So we started making some modifications again to our wellness program. We actually noticed, if you look back, going back the last 3 years, that our participation, even with the retirees added in, we're still sticking in right about 100 people. So we discussed the idea of increasing our incentives, which by the end of 2017, we got approval from our general manager. Just on a side note, originally our incentives were the full payout amount for employees, and then 50% of that for the spouses if they reached, it was a 4-tier level incentive payout. So if they reached the top tier, employees got one amount, spouses got half. When we presented the increase, we kept that same idea, employees get this, spouses get half. And it was actually our general manager who, after our presentation, came back to us and said, well, why are we doing that? If we want the employees and the spouses to both participate equally, and we need them both to be healthy to help our, bottom line and health insurance and keep everybody happy and healthy, why aren't we offering them all the same incentive? So we ran with that, because as soon as he said it, it was out of his mouth, and we were just like, okay, well, this is how it's going to be. We're gonna increase this incentive across the board for everyone. So employees, spouses, retirees, and retired spouses all were at the same payout level when they reached that top tier. We also, we branded ourselves. That is our health and wellness logo. If you remember earlier on when we were getting introductions and Teresa talked about the BPU, you can see there are a lot of similarities. We kept the shield shape. We used the same fonts and ideas so that it blends well with the BPU logo, but it gives us a way to kind of mark ourselves as team members. We actually had shirts made up. So everybody on the team has a shirt. We wear them for events and different things. I mean, everybody at the BPU, we've got 150 employees, so everybody knows who's on the team. But it's nice to kind of promote that and show that we're proud to be a part of that team, and that we're proud to be able to help our employees get and stay healthy. So again, that's kind of where we were there. So in 2018, we kicked off that proposed incentive increase, which, as you can see, we went from 100 participants in 2017 and right up to 151 participants. So very big reception to that increase. It turned, a few folks who were on the fence as to whether they wanted to participate or whether they still believed that we were going to utilize this information for some nefarious reason, which we don't, obviously. Everything we get, reports and things, all aggregate totals. Everything comes in, just helps us to kind of guide our program in the right direction to help our employees with whatever they may be suffering from percentage-wise the most. Typically overweight, diabetes, and heart disease, pretty much the standard stuff. We also, in that year, we got what we consider to be one of our biggest accomplishments as a team. We received a letter from the spouse of an employee in the very first carotid artery screening, that we offered. She tested, they do the screen, and she came back with, I think it was 75% blockage. It was insane. She was perfectly healthy. She's a dietitian and nutritionist, so she ate healthy. She had family history. She was still, she was older, but not terribly old. And she knew about the family history, but hadn't bothered to have anything done yet because, she was feeling well. She was taking good care of herself. She immediately went to her doctor. She was put on statins and other medications. The following year, she got tested again, and it had decreased. Her blockage had decreased a little bit, but by the screening in 2018, she had reduced her blockage down to 30%, I believe was the number. And she was so happy. She wrote us a glowing letter, made us all feel amazing. We had her come in to a lunch and learn and speak to our employee base. She was more than happy to do that because she, being a nutritionist and dietitian, she does that on a regular basis. She talks to a lot of folks. But she was amazing. She did a great job, and we're so happy that she, like it says, she is certain that we saved her life. She was sure that it was just a ticking time bomb that she did not know was there, and that she could have just stroked out, had a heart attack, coronary, something terrible at any point in time. So, and then to take that back to our side of things, from the business side, we saved her life. That also reduced, if that major catastrophe had happened to her, that would have been a huge hit on our health insurance. So we can show now that this program has extreme benefits to our employees. Another employee had really high blood pressure, got caught during one of our biometric screenings. He was immediately sent to his doctor, put on medication. Since then, he has lost weight. His blood pressure is under control. He's actually out. He's moved from working inside to being out in the field. So all of these things have helped him to be a healthier employee as well. And this was also the first year where we were awarded first place in the Western New York's healthiest employer, and then also named as Interactive Health's healthiest company, one of Interactive Health's healthiest companies in America. So all of these great things happened all in this one year, and it makes you feel really good about how your program's going, how you've moved forward. So in 2019, our wellness vendor introduced the flash challenges, which were challenges that popped up. I think there was one a week, and it took less than a day to complete them. Very quick and easy to do. We still had good participation, about 150 people. But the big part about 2019 was that 69% of our participants met their personal health goals. So the way the biometric screening was set up was you were ranked in a tier based on the different things: blood pressure, triglycerides, cholesterol, and the personal health goals were set based on where you fell into that range. So if you were on the healthiest range, your goal for the following year, stay in that range, don't drop. If you were in any of the other ranges, like your goal was to do your best to move into the next range, become a little bit healthier. So 69% of our population was able to do that in 2019. Another huge thing for us, huge goal. We were super excited. And again, in 2019, we also were awarded first place in the Western New York Healthiest Employers. And in this year, we also, for the first time, made it onto the Healthiest 100 list, which was through Springbuck. I believe we ranked 46th. Which, considering we're up against like some of the names that were higher up on that list were like Fisher Price and really big name companies, we were very, very, very pleased. So 2020, yeah. 2020 was not good. Obviously, COVID. We actually lost our wellness vendor. They were a casualty of COVID. They ceased to exist sometime in May. Really not good timing. It was right before we were supposed to do our biometric screenings for the year. And everything just kind of, and it was a really sudden too. It was, we received an email, I think we got a heads up from Nova on like a Monday, and they said, this is what's happening. It's gonna happen fast. We don't know if we're going to have access to the data that was available to you previously. And we were like, holy cow, what do we do? So the first thing we did was immediately, we do a weekly wellness email and a whole bunch of other things, but we immediately emailed all of our employees, talked to all of our team members, had them speak to, their fellow employees in their divisions and explain to them what was happening, and that in order for them because we didn't want anybody to lose credit. Our program is incentive points based. So we didn't want anyone to lose credit for all of the points they'd already achieved in the beginning of the year. So we had to basically go back to our 2014 program where we all of a sudden, everything kind of became paper-based, spreadsheet-based. And we, had all of our employees screenshot how many points they had available at that time. And then going forward, everyone was instructed to email their wellness team. We have our, being branded, we have our own wellness, we have our own email address and everything. We were told to, we told everyone to just, if you have a preventive exam, if you do anything that would have normally fallen into any of the points that we were offering at the beginning of the year, you just need to notify someone on the team. We will track it, and we are working really hard to onboard a new wellness vendor and implement a new online portal. It was definitely some crazy. There was a lot of back and forth. We went through several different potential vendors, finally settled on one, got things moving in the right direction. And it wasn't until September 1st, with all of the changes and all of the tweaks that we needed to make in order to get things kind of up to speed where we were at the beginning of 2020. So it wasn't until September 1st where we were able to go fully online with the new portal. And there were obviously some changes, some differences that were there. And what ended up happening is we allowed folks to continue to record points onto the new portal while also tracking their old points that they had already reported. And at the end of the year, when we got the report of how many points each employee had received through the new online portal, we added everything together, and then we're able to pay out our incentives.
I'm just going to step in here, Trenton, if I could just interject for a moment. On the Nova side, we actually stepped in to help facilitate a lot of that transition. A lot of the data was housed with us. So we had to make sure that we were able to transfer a lot of that over. We had to do some internal work. So this is where a TPA actually working to support your wellness program is very helpful, that we can step in and actually bridge some of those gaps. As like Trenton said, we knew when the vendor went bankrupt, it was very sudden. There were a lot of questions about the actual ownership of the data because it had been subcontracted out to a second party. So that did add a lot of complexity in addition to what was already the complexity of 2020. But I think what I really like about this workplace wellness solution, and Adam, you said this about Phia as well, it's something that nobody expected right out of the gate, that it was going to be hugely successful and we were just going to go from there, and that was going to be a big savings in that first year. It actually evolved over many years. Adam, you said it was 5 years for the Phia Group. So I think it shows a real evolution of how you get buy-in. So when we talk about voluntary programs and what makes programs actually voluntary, I think this shows as well the trajectory over time of how people are enticed, not induced, into joining the program. They see the benefits. I mean, I can't imagine a better advertisement for a wellness program than saving somebody's life from a carotid artery screen. Adam, you got your hand up?
Yeah, I just want to ask a question to Trent, if you don't mind. So Trent, you brought up, that woman or the spouse whose life was saved. You brought up the fact that, aside from saving her life, there's a lot of savings there for the health plan, right? There's no emergency visit, no surgeries. One of the big pushbacks, as you can imagine, when it comes to wellness, and we hear it all the time, Phia represents 15 million lives all across the country. Every type of industry, every type of organization, from truckers union to, a yoga studio, is how do you show the return on the investment? And my answer always is, you're not going to see it year one, right? How do you show someone not getting a heart attack, right? How do you have that savings? But over a period of time, have you seen either a flattening or a reduction in overall claims cost per employee or per participant? Can you share any details on that?
I don't have a whole lot of details on that, Adam, but yes, I do know from speaking to like our HR director and some of the folks at Nova and some of our consulting groups that yes, we initially saw it plateau, and we are seeing a slight decrease as of now in overall healthcare claims, and also even pharmacy, related costs.
One of the big things I would advise you to do, in addition to this, is, with COVID, what many employers, and I know this isn't a COVID webinar, but I think it's tied. I mean, you talked about it in 2020, right? I mean, it caused you wellness vendor to go out of business. But what people think about is, to be honest, in 2020, it wasn't that hard to be successful in your self-funded health plan. Why? Because people couldn't get treated. People couldn't have surgeries. They were delaying elective surgeries. So many employers, without trying too hard, unlike you guys, where you're putting a lot of effort into your wellness plan, like us, where we're doing a lot of things for our plan, a lot of organizations out there said, wow, self-funding's great. Look at our year. 2020 was awesome. But yet, somehow, when 2021 came into place and they were purchasing stop loss, I'm assuming you guys have stop loss based on the size of your company, stop loss premiums somehow increased. And you're thinking to yourself, how did stop loss premiums go up if they had a banding year as well? Every stop loss carrier had a great year last year. Why? They're petrified of what's to come. And what they're petrified is two things. And it's all in your claim. Anyone listening in, it's in your claims data. One, what are the types of claims now that you're seeing that you weren't seeing last year? A lot more depression claims, a lot more people on antidepressants, a lot more people going to treatment facilities, alcohol use up. opiate abuse is up. So most of those facilities, Trenton, as you know, they're not in Buffalo. They're not in upstate New York. They're in Florida. They're in Arizona. Come to Arizona and go to this treatment facility. It's out of network. So what people are worried about now is more and more people who did not get their cancer screenings last year. Guess what? This year, instead of having that early signs of cancer, it got stage 2, stage 3. Therefore, the claim costs are higher. Pharmaceutical claims are higher. So what I would tell people is when you look at wellness, don't just look at it from a standpoint of lower hospital costs or lower physicians costs. Look at the trend of pharmaceutical costs as well. What can you do to combat the increasing cost of drugs? Alternative, generic versus brand, things like that. Because I'll tell you right now, what we're seeing is prescription drug costs skyrocket right now based on what the behavioral changes from COVID as well. So I'll stop there.
The behavioral health is actually a good segue. And then I do want to get to a couple of the questions that we have. Our last webinar a couple of months ago was all about telehealth and how that has actually expanded a lot of options for things like behavioral health. So we do have all of our previous webinars available on our YouTube channel. One of the questions that we got was to get a copy of the slides from today. So we will make those available. This recording will be available to participants of today's session. And in August of 2021, we're going to be talking about medical management in a little bit more detail. That's the green band of the spectrum. But hot on the heels of that one is actually going to be one talking about pharmacy and how that has changed. And there are so many high-cost drugs out there. Some of them are very effective, but you want to make sure that you're delivering the right medications to the right people in the right way, and that they're actually, staying compliant with their medication program. So with our last 4 minutes left, I do want to ask, we've got a couple questions here. One is, would you say there is a large disconnect in the government's efforts to promote wellness solutions and the regulatory noise in which employer wellness programs operate? I would say yes, just based on
I agree. I definitely think that, there's a conflict there based on what is happening, and, financial considerations are bigger now than they were ever before, especially given the fact that we're coming, off the heels of the pandemic and high unemployment rates. So money is everything to everyone. So this concept of what is coercive, what is voluntary versus involuntary based on the level of threshold of incentives is a huge sticking point right now, and it would be really helpful to have some clear guidance that we just don't have.
Right. I mean, a lot of times the government really functions as more of a public health entity, whereas employers that are in the healthcare space, they're really looking more at individual health, which is why you need a good TPA partner to help you really personalize a lot of your recommendations and really go into the data. We don't look at it from the public health perspective the way the federal government does, where it encompasses all of America. We can really drill in on populations like we've done with Trenton and the DP. And Adam, you may have touched on this a little bit before, but another question is, what are the guardrails for companies that want to offer incentives around COVID-19 vaccines?
Yeah, and I can jump in on that. So
listen to our webinar next month. All about it. Or last month.
We're definitely going to talk about it, but I can give some high level. So employers can offer incentives for people to get vaccinated. Again, it triggers potential interaction with ADA and GINA. So similar to wellness programs, you have to be cautious.
Kelly, right. I've seen some of these incentives, right? And again, they're not major incentives, right? We're talking about gift cards and things like that. But to me, it's this. Oh, I'm not getting vaccinated because I'm afraid, right, of whatever. Oh, wait a second. You're going to give me a gift card? Sure, I'll get vaccinated. It just doesn't make sense. The incentives tied to vaccination, I just don't see how that's going to really work, to be honest with you. I think the incentives tied to, getting tested, maybe that part of it where they got an extra PTO day, right, to go out and actually get tested and all that stuff, even vaccinated, a PTO day, because people get vaccinated, the next day they get sick. We've done that. It's worked. There's also a credit for that, right, Kelly, from the government as it relates to actual PTO days tied to vaccinations. But outside of that, I just don't see how a gift card to Macy's is going to force someone to decide to get vaccinated versus, no, I don't want the side effects, or I think I'm getting a chip put inside my body. Oh, but wait, I'm going to get a Best Buy gift card. Thanks. I'm getting vaccinated. I don't know.
I will say the only thing I really want to add here is just to because the rules again get kind of confusing when it comes to ADA and GINA, but the one thing that employers have to be careful of is you can offer an incentive for employees to get vaccinated, but not for their dependents to get vaccinated from third-party vendors. So if like you are giving incentives for them to go to their provider, the PCP, whatever, to get the vaccine, you can't give an incentive for their dependents. So, and you can't give it to the employee or the dependent. So that's the only thing to really consider with this vaccine, is that was something very clearly noted by the EEOC.
Teresa, if you want, we put together, and we had it available for our last webinar on one of our breakouts, an entire program of what we're doing when it comes to the vaccination, return to work policy. Can you require them to come in a certain number of days? That's another big thing, right? Getting employees to actually come back into the office. You know, think about it. Pre-COVID, it was like, yeah, of course you're going to come in 5 days a week. Now, most companies out there are saying, all right, we'll do a hybrid approach. Well, how does that work? What can you do? What can't you do? We put a whole guideline in place. So Kelly, feel free to share that with Teresa and the Nova team, because obviously you guys are a great client of ours. Folks, I want everyone that's listening to know, we don't do this for everybody. We truly believe in what Nova's doing and what they're doing on behalf of their employees, employers. Many TPAs out there are really looking at this from a auto adjudication standpoint. Get the claim in, pay it, get it out. It's very rare to see TPAs out there that actually look at and care about the actual overall cost of their employers and their membership. So what I think what you guys are doing, what Trenton is doing, that partnership has worked, and we're very excited here at Phia to be part of that partnership as well. So thank you.
Well, we feel the same way about you, and I think we'll close there. So we will make this recording available if you want to sign up. If you're not already on our email list, we'll keep you informed about our upcoming webinars. Thank you all for being part of our Spectrum series, and enjoy the rest of your day. Thank you so much.
Bye.
Bye.
Thanks. You guys.